Hello, I'm Valerie Brown, and welcome to our Sunday conversation. I'm here with Dr. Elizabeth Jett of the OU Breast Institute. Welcome, Dr. Jett.
Thank you.
Will you briefly describe for us what you do as a director of imaging and why what you do is important, an important component of breast health?
At the Breast Institute at OU, we do all forms of breast imaging. So we do screening mammography, diagnostic mammography, ultrasound, and breast MRI. So as director of imaging, I'm just in charge of making sure it all runs smoothly, but I'm also the only one there reading the studies. So mainly what I do is the clinical work, reading the studies, seeing patients, and taking care of just whether it's their routine screening mammogram they're having done and they're not having any problems, or when they come in and they're feeling something, making sure it gets worked up appropriately and that all their questions are answered.
Why is that an important part of the screening process and for breast health in general?
The best method we have right now of screening for breast cancer and detecting breast cancer early is through mammography. It's not perfect. It picks up somewhere in the range of 85 to 90% of breast cancers, but we can pick them up before they're felt, which often gives you a couple years of lead time in treating the cancer. We can find very small cancers before they've developed the ability to spread elsewhere in your body. And so mammography is really the key. In terms of dealing with breast cancer today, the secret is to pick it up early. So early detection, we don't have a prevention out there. There's no vaccine you can have or medicine you can take to keep from getting it. Finding it early is the answer, and mammography is the best way we have to do that.
So early detection is very important in breast health. What are the other keys to proper breast health?
Recommendations include screening mammography every year for every woman over 40. It includes a clinical breast exam, which is an exam that your physician does, as opposed to the self-breast exam that you do. So your physician should do a breast exam every year, and it's recommended that you do self-breast exams on, we used to say every month, now we say a regular basis.
Okay.
And we want women to start doing that very early so that they become familiar with their own pattern and what their breast tissue feels like at a point where it's not likely to be abnormal, so that they've done this so much they're comfortable, they recognize a change. And that's really what we're looking for. Women ask me all the time, I don't do my self-breast exams because I don't know what I'm looking for. You're looking for a change. You're looking for an area of firmness that didn't used to be there. You're looking for a lump that didn't used to be there. You're looking for nipple discharge that didn't used to be there. You're looking for pulling of the skin, thickening of the skin that didn't used to be there. And women who do their breast exams on a regular basis are very, very good at picking up subtle changes that even your physician might not notice, because everybody's breasts feel different.
And that is another key point. I know that detecting these abnormalities in the breast is often difficult. Why is this? And what do women need to do to become used to their own breasts?
There is no normal anatomy for the breast in terms of what you feel and what we see on imaging. It's not like a CT scan of the head or the abdomen that I could draw you a picture and say this structure should be here, this structure should be here. When you see things that shouldn't be there, we know it's abnormal. Everybody's breasts feel different, and everybody's breasts look different on a mammogram. So one woman may have a lot of fat that feels very smooth and homogeneous when she does her exam, and it's very easy for us to see through on a mammogram. And another woman may have a lot more dense breast tissue, glandular tissue, that feels lumpy bumpy. It may feel firm at times. It's going to vary at different points in her menstrual cycle as to how it feels and how prominent certain areas are. And her mammogram is going to look dramatically different. It will be more white, so it's harder to see things through, and you can have areas of tissue in one part of the breast and not somewhere else. So if I have an area of white in one part of the mammogram, I need to know whether that's breast tissue, whether that's cancer, has that always been there? So from my point of view as a radiologist, the best way for me to do that is to look at old films. So we already know that the first time a woman has a mammogram, she's more likely to be called back and have things worked up than on subsequent mammograms. But that requires that we have access to your old films. So one of the best things women can do is pick a place to have your mammogram and go back year after year after year. Don't mammogram facility shop,
Sure.
Going someplace different all of the time without taking your old films with you. Certainly with changes in insurance, you moved, where you went before isn't convenient, whatever, there are reasons to switch. Go pick up your old films and take them with you.
So trying to stick with the same doctor is important, and keeping a hold of your medical records, excuse me, and your old images is important. What, as a practitioner, what do you think is important in picking out a doctor? What are the key factors?
In terms of picking out the radiologist who's reading your studies, One of the most important things is that they do a lot of it. Like anything else, the more of it you do, the better you get. And if this is all you do all day long, you're going to be better than somebody who's reading a handful of mammograms in between, the brain MRs and everything else that they're doing. So the requirements, and we're regulated by the federal government. Everybody who reads mammography has to meet certain minimum requirements in terms of how many they read per year and the continuing medical education that they're having. But the more that people do, and if people do both screening and diagnostic work and biopsies, they've had the opportunity over a period of time to get some feedback on what they're reading. They know when they look at a screening mammogram and they bring them back and work it up, what we're seeing. I know what I've called back, what ends up being significant and what doesn't. When I biopsy things, I can correlate that with this is what it looked like, this is what it ended up being, and you build a body of knowledge and experience. But if you're just reading the studies and sending them off elsewhere, you're not having that learning opportunity. So places that do comprehensive breast care, from screening through biopsy, and that do a lot of them, will have more experience and therefore do a better job. The other thing that I think is always important for women to remember is pick somebody you're comfortable with. If you walk in and you're just not comfortable in the environment, it's not a good place for you, even if everybody else says, oh, but it's a wonderful place.
And I'm sure you're more likely to switch if
you're not comfortable.
Want to go to another doctor.
If you feel like your questions aren't being answered, you're not getting what you need to be comfortable, and you need to have confidence in the person that you're dealing with.
Perfect. Thank you so much, Dr. Jett. I'm Valerie Brown, here with Dr. Elizabeth Jett, and thank you so much for joining us for Sunday Conversation.